When I talk to folks in Northwest Florida and I start talking about Medicaid, people's eyes start to roll in the back of their heads because, they may not be on Medicaid. They might not know what Medicaid's all about. Well, Medicaid is not an insurance program like Medicare. Medicaid is a public welfare program to provide health care services for people who have fallen on hard times or meet some kind of federal or state criteria. But here's the problem, Steve. Medicaid consumed 18% of the budget in 2000. It consumes 28% of the budget at the end of 2010 and a much bigger budget. The costs of Medicaid are crowding out public education and public safety and environmental concerns and economic development because we have more and more people on Medicaid, and the federal government is creating more categories of people who are qualified for Medicaid. In Medicaid, it's federal rules that set how we are going to operate, but then we get stuck with the bill here in Florida. So I'm joining with Senator Joe Negron and Senator Rene Garcia to propose a comprehensive overhaul of Medicaid that will make Medicaid certainly not worse, but it shouldn't be better. The people who are working people, who are making $30,000, $40,000 a year, paying their taxes, taking care of their own health care, and then are subsidizing the health care of others on Medicaid, gosh, the people being subsidized shouldn't have better benefits than the people paying the taxes. So we need to make Medicaid responsible. We need to get rid of the fraud and the abuse that are rife in the Medicaid system. And we need to have ways to manage cost predictability and improve access so that Medicaid patients can get primary care, not use the emergency room for their doctor's office, and make sure that we can have a healthier population, but frankly a more responsible Medicaid population, responsible for some of their own health habits and their own care.
I understand that if you make some fundamental reforms in the Medicaid program, that you would have to seek a waiver from the federal government to be able to do so, and that's not necessarily guaranteed. What would be the steps that would have to be taken if the federal government did not allow a waiver?
Well, again, the federal government makes the rules and we get the bill on Medicaid. So we're going to be asking the federal government to give us a waiver to establish a Medicaid program that's right for Florida. We need to be able to say, here's how much money we can afford to spend on Medicaid, and then devise a plan that's good for Floridians. Now, we get a bill at the end of the year for $200 or $300 or $400 million in extra costs that the federal government says we have to pay. There's no other program in state government, no other department. The Department of Transportation doesn't come in and say, well, things just got away from us and we built $200 or $300 million more in roads and bridges than we thought we would. So could you write the checks? We don't say that to the taxpayers, but with Medicaid, that's what happens because of the nature of Medicaid and the nature of federal rules. So we're going to ask for waivers to be able to have more responsibility on Medicaid patients and have a more sane system. Now, the federal government a couple of years ago wasn't interested in any kind of waivers for states, allowing states to develop their own Medicaid system. But following the 2010 mid-year elections, believe me, the Obama administration is a lot more interested, even in states like Arizona, and that's not President Obama's favorite state. The governor there is not his favorite governor. Even Arizona has been given substantial new waivers to develop a Medicaid system that's right for their state. So we think if we have a sound policy to present, and I think in the Negron bill we do, we'll get Medicaid waivers from the federal government. If we don't, and we're going to give the federal government 100 reasons to stay at the table and work with us. We certainly don't expect President Obama to walk away from Florida's most vulnerable citizens. But if not, if the federal government won't work with us, then what we have in our legislation is a clear indication of what we would be able to do with state funds if the feds walk away. But I don't think they'll walk away. They're granting waivers to other states. We've got to get Medicaid costs under control, or we're going to lose our public education system, we're going to lose our environmental protection, and we're going to lose public safety.